today is to bring together agendas to try and meet particularly schools and troubled families, because I know where we've been working, people have said schools aren't aware of what's going on in the troubled family agenda. There's a huge amount of money there, how can we access it, those sorts of things. And likewise, troubled families teams have said we can't engage schools particularly well. So that was part of the thinking behind today. We wanted to show you some examples of best policy and practice that we've seen. And we just want to look at cost effectiveness, because we're working in a few areas looking at how to evaluate your services to make sure that you're bringing about sustainable change and doing the right things. Why we've called it Any Way You Slice It. When I used to work for the government and we talked about think family reforms to local authorities, this slide, which is still valid, I used to talk about this, and it's still, I think it's a really powerful slide, because it talks about where the money's coming from nationally, multiple funding accountabilities, and basically the effect on families and how that results in potentially ineffective and really expensive provision. So lots of people have seen that slide, but things have not changed dramatically enough for me to not put that slide up. Now I'm delighted to introduce our first speaker, Ian. Ian's the Deputy Delivery Manager for the Troubled Families Programme, and he's worked in the Department of Education for 4 years, and DCLG, worked in the Respect Task Force and the Home Office, so he's got a lot of experience around working with vulnerable families. Thank you.
Yeah, because I'm just going to go back and just do a quick recap of the current Troubled Families programme. I was going to do a little bit of kind of progress, just a kind of update where we are on where we are nationally, and then share our thoughts, early thoughts I have to say. Indeed, we had most of the Troubled Family coordinators in for a big conference earlier this week to try and have an early conversation with them about where we're going on phase 2 of the programme. I think it's important, particularly for schools. So many people who get to kind of families much earlier than we currently are. I think we're very keen that you get involved in the programme. So it's very encouraged by not just the number, but the kind of variety of people who are here showing an interest in the programme. Just very briefly then, the kind of background to this. So we're now into the second year, coming towards the end of the second year of the initial phase of the Troubled Families programme. We were challenged by the Prime Minister to both find and turn around the lives of 120,000 of the most troubled families. We were given national targets around within these families once we identified them, making sure we were keeping the kids, the children in the families in school, so there was a target around getting attendance up. A clear target around reducing youth crime and antisocial behaviour in the families, and perhaps the most challenging one was trying to get at least one, if not more, people in the family into work. And I'll come back to the work one. It's been quite a few eyes. It's been quite an important driver of the first programme. We were very pleased that all local authorities signed up to this, so all 152 local authorities across England signed up to the programme. Yes, as Wendy said, quite a significant investment, 448 million for the first 3 years of the programme. Although the idea was that would be matched by a local authority wanting to go against that. So that's not the whole sum of the money that's going to tackle the problem. We were very lucky. We did a lot of work early on in the programme to come together with DWP, and some of that was about some rather boring but critical stuff around data sharing, which was about, as a symbol of the joint working together, we managed to secure 150 Job Centre Plus secondees to work alongside troubled family coordinators across England. We've made great progress starting to align our programme with public health's agenda. Some of you from the public health or health field, I think there's such an overlap between what we're trying to achieve with these families and what public health are trying to achieve in terms of their priorities. We've done a lot of work to bring those programmes together. We're very lucky the programme has an independent evaluation, as Nick will know. There's not many bits of Whitehall who are allowed to have a full national evaluation programme at the moment, so we're very lucky to have that. And my particular role is I have a small team who works closely with local authorities, particularly with troubled family coordinators, to support and challenge them to drive the programme forward. Why troubled families? Again, we just work through stating some of the basics. And these families are both troubled, and they also cause trouble. So they have a lot of troubles, right? There's no doubt about that. But they also cause problems to the local communities and arguably to the state more generally. So they are troubled families, but they also have troubles. And we recognise there's two sides to that equation. As Wendy says, they tend to attract multiple uncoordinated services. These families tend to attract quite... we put up there 20 agencies involved with one family, and I come across cases still where there's like 20, 25, 20 more agencies working with the same family. As I say, they have a high impact on the community, and they're a huge drain to the public finance. So we estimate that each family costs, in reactive costs, about £75,000 per family on average. So we're spending about £9 billion on these families each year. If you look at the reactive costs, we spend nearly £4 billion a year in the child protection system for young people. So we wait until young people have gone so badly wrong that they're caught up in children need plans, child protection plans, or we take them into care or foster care. And then at that point, we spend £4 billion on these families. We wait until the family or members of the family get caught up in crime, and then we wait till they're in the court system or in prison, and then we spend £2.5 billion on them. So, there's just a kind of clear case that we're just getting this wrong. We're spending money in the wrong place. Interestingly, when we look at the kind of the money that is spent a bit upstream, the most significant of that is spent in education and early years provision, which again is why we're very keen to get early years services and schools much more involved in the troubled families programme. In terms of where we are to date, I think, we were just hugely impressed with the way local authorities and their partners have kind of grasped the issue, if you like. We've already, when we first started this programme, and Catherine will know this, Don will know this, people were actually very sceptical about whether we would find these families, right? Whether these families existed, whether we had the right information on them. This is very unusual for a national government programme. It's not, we're not dealing with cohorts of people, or we were actually trying to identify named families across the country. So a very unusual government programme to drive from Whitehall, which is why we're very dependent on our local partners. I'm pleased to say, as of last month, over 111,000 of the first cohort of families has been identified. So 111,000 families plus 94% of the families we're trying to identify have already been identified. That means we know who they are, we've got the names, we know the composition of the families. 97,000 of those families are already being worked with. And I'll come on in a minute to explain the way we're trying to work with the families. And a hugely impressive 39,000, nearly 40,000 families have already been turned around. Now, by turned around, what we mean is we've now got the children back into school, we've got the crime and ASB down in a sustained way, and in a number of cases we've got families either into work or making good progress to get to work. So 2 years in, we think we've made incredible progress, even though there's still a lot to do. A lot of this is building on what worked before, but just very briefly, this is the approach that we promote, and the approach that we know is having such an effect in turning around so many of these families. I'll just quickly skip through it, but this is what we call the family intervention factors. So what works with these families if there's a dedicated worker dedicated to the family. So the whole approach is based on one key worker responsible for the family, and that relationship that they build up with that family is absolutely critical to gaining the trust, getting through all the barriers they've had to working with social workers and other statutory providers in the past, and building up a relationship of trust. It's based on trust, but also on challenge. Right? These workers, when you meet them, are pretty challenging of these families. My boss calls them family intervention workers. Sort of family. They stick their nose right in the family, get underneath what's going on in the family. they look, as I say, they look at what's really happening for the whole family. So it's a whole family approach. It's not just taking little Johnny who's in trouble with the police, let's look at how we sort that out. Dad over here that's not worked for 30 years, somebody just works with them. So-and-so over here, kids not getting to school, they've got an education welfare officer over here. It's somebody who looks at the whole problems in the round, including necessarily the extended family. So this is a whole family approach. It builds on, it bases itself on kind of good hands-on practical support. So these are workers who, you know, in the early days, get in about the family, help them clean up the house, get in about the family, get a kid, are there in the morning to help mum get the kids up to go to school. If necessary, go with the kid to school to make sure they go in. Who actually goes in and opens the drawer with all the kind of letters that chasing people for debts or kind of been hidden away. It's kind of really based, it starts with kind of really fundamental, basic, practical support for the family. And these are interlinked. That's how you get the trust for the family. You're helping them with the things that are most important to them. It's assertive and it's challenging, and its approach is not frightened to use sanctions if necessary. So they don't necessarily carry out the sanction, but they're quite upfront. If you don't work with us, then your children may well be taken into care. Right? If you don't work with us, then you might lose your tenancy if you don't pay your rent. So it's pretty hard-edged work as well. And it's based on an agreed plan, a plan not just agreed with the family, but agreed with the other partners. So to try and cut through this idea of 20 agencies, everybody agrees to sign up to the one plan. So it's one family, one worker, one plan. And that's been proven to work with these families. Very quickly then, just to move on to phase 2, because I know that's what a lot of you will be interested in. Because Catherine and Don will know my problem is to keep the focus on phase 1, because we've still got a lot of work to do on phase 1. But nonetheless, we have been challenged by ministers based on the kind of early success of the programme to move on to phase 2. So we were very lucky in the last spending round to secure an extension of the programme for up to another 5 years. So again, based on the success we've had so far, but also in recognition that a lot of these families have intergenerational problems that really, if we're going to kind of break through it properly, then we're going to have a long run at this. And this is certainly, as Wendy said at the beginning, rather embarrassed, I've been involved in quite a few national programmes trying to work with families in different. This is the first time I've been involved in a programme that's got 8 years to run at it. And we've got, on top of what we originally had, we've got promise of another £200 million for the next 5 years. So it's a long-term programme, and it's got significant investment for a long term. So we have a real opportunity here to break that cycle that many of these families have caught up in. The challenge, of course, once you say you're starting to get 120,000 families, ministers want us to go further, so they've asked us to widen this out to a further 400,000 families, and I'll come on to that in a second. And this time, implicit in the first phase of the programme was that in doing this we would save money to both locally and to the national public purse. That's going to be much more explicit this time round. We're going to be much more challenging to areas where it shows where you're actually making the savings and reinvesting those savings that you make. And we're currently, as I say, working with local areas to work out what phase 2 of the programme will be. So I say £200 million for the first year, which is what we can only commit to at the moment. But then beyond that, we have another 4 years of money, 400,000 families. And the idea, and I'll say a little bit more about this, is we try to get into families before they reach crisis point. So the idea is we get in earlier. And I might say a little bit at the end, Wendy, about where I would draw. I don't know where we draw the line between getting in earlier versus an early intervention plan, but we will say a bit about that at the end. Again, there'll be a pot of money available. The first phase of the programme was based on a payment by results programme. So local authorities got so much money up front for a family. Once they'd achieved the outcomes that I said earlier, then they got the reward payment, if you like, or the extra money. And the second phase will also be based on a payment by results model. Now, I think as we enter into phase 2, I think we have to build on the information that we're beginning to get on the current families we work with. So we, as I say, we've got a national evaluation running. We're currently looking at the kind of the information we get on the first batch of 9,000 families who we've collected information, families that have been through the first programme and have been turned around. And if anything, it just kind of brings home the complexities of the families. I mean, just to give you a little feel for it, the families that we first looked at in evaluation, on average they have 2.5 children, which is compared to a national average of 1.7 children. 40% of the families have 3 or more children, which compares to 14% nationally. There are 3 times the proportion of lone parent families in the first batch of families, again compared to the national average. And the complexity of the problems are perhaps even more complex, if you like, than we even imagined at the beginning. So the range of problems and the number of problems that cut across employment issues, education issues, health and crime, ESB, is both much deeper than we thought and much more entrenched than we thought. And within that, 1 in 3 of the families have a child who is involved in the child protection world. So they're either a well looked after child or a child protection plan or a children in need. So, I mean, at one level that's a testament to the kind of progress we've made with these families, but it does just throw down the gauntlet for the next, to turn around the rest of the families, and tells us a lot about the intergenerational nature of the problems we're trying to do here. But as I say, we, in terms of moving on to phase 2, we're trying to identify a group of early starters, a group of local authorities who will come with us on the journey. Basically, in terms of the next phase, we do want to try and get into families earlier. So at the moment, the programme tends to take us towards older members of the families. So we look for young people who are caught up in crime and ASB, so that takes you towards kind of teenagers in the family. Because we're looking at people who are on out of work benefits, again, takes you towards the adults in the older end of the family. We want to look in the next phase how we can bring that down a level. So I'm particularly pleased to see, obviously very pleased to see secondary schools here today, but very pleased to see so many primary schools here today as well, because again, our experience in the first phase of the programme is it's kind of primary teachers, nursery teachers, people who work in children's centres, health workers, family nurses. These are the people who spot early on where they might see an individual in the family. So they might see the kid who's coming in and they know hasn't had a breakfast and they know who's fallen asleep at the table. What we need to do is move that concern about that individual family to see that as an indicator, that about that individual child, to see that as an indicator maybe something's going wrong with the family. And then once you've spotted that, knowing where to take it. So we need to break through this barrier where some teachers think, oh my God, there's a problem there, but I don't want to phone social services because they'll just take the child into care and that'll be a nightmare. Yeah? As opposed to another teacher thinks, oh my God, so-and-so's fallen asleep, I better get social services in now, and then kind of the whole weight of social care lands on the child. So we need to find a constructive way to get in earlier. The other major issue we want to come at is, again, what we've learned in the first phase of the programme is just the sheer levels of violence that is in the families. And it's not just domestic violence doesn't quite cover it really. It's not, dad coming home drunk and beating up mum, although that does happen quite a lot. It's family violence, it's siblings, it's 14-year-olds hitting mum, it's 14-year-old fighting 16-year-olds, a culture of violence in these families. And again, that seems to be a culture that's passed down through the generations. So we were aware that kind of the lack of employment was passed down the generations, but the kind of emotional problems that come with these levels of violence being passed down through the families is something we want to get to. And as I mentioned earlier, the kind of levels of physical and mental health issues amongst the first amongst the families we identify is quite considerable. And again, we need to go on a journey to work out what is the best way to tackle that within these families. That will be on top of continuing to do the work, to build on the work we've already achieved. So we do think getting somebody into work in these families really can make a huge difference. And I've seen it with my own eyes, you know, kind of mothers who haven't worked for maybe all their life, you know, or since they had children, and everybody's written off their work opportunities, you know, and then when you see, I saw a woman the other week who had never been in work since she left school, and the Job Centre Plus worker got her 30 hours a week working in a local hotel, right? And she changed, right? You know, she physically changed. You know, she stopped taking most of the drugs she was taking for her depression. But most importantly, she had started to have a different relationship with her children in the family, because the children, for the first time, stopped calling her a scrounger. Right? You know, the kids. So when the kids saw their mum as a scrounger, right? And suddenly she found her relationship changed with her 4 children because she had a job. So I wouldn't underestimate the importance of that end of the work. So we're going to continue to focus in on work, continue to focus in on getting children back into school. I'm hugely impressed by the work areas have done to get children into school. And remember, these are some of the most difficult children who've been either chucked out of school or avoiding school for years. And the progress being made in getting children back into school is absolutely phenomenal under this programme. So we'll build on those things, but as I say, we want to find a way to get in earlier with these families. And maybe just to finish off then, Wendy, just to kind of come back to the kind of the theme of your day, if you like. It is about turning around the lives of 120,000 families and now broadening that out, but it is a real opportunity to transform the way we work with these families and do it in a much more effective way, both more effective for the families, but as I say, more effective for the public purse in terms of how we're using it, how we're using the money. But I am interested, the reason I'm here today is I'm genuinely interested in this discussion about whether this is I don't think the Troubled Families Programme is an early intervention programme, right? I think local authorities are developing early intervention strategies, and I think a lot of the learning about the early intervention, Graham Allen's work, I think will help to inform that. But I think this is about families who've got troubles and spotting it earlier. And I think there is a difference, which maybe will come out as the day goes on. I think this is a very targeted programme and will continue to be a very targeted programme. But it must sit alongside what local authorities are doing on broader early intervention strategies. But for me, this part of the programme is a bit of the programme that's working, but I do want to get to the point where the primary teachers, where nursery teachers, workers in children's centres, people that spot kids before they go to school, when they get to primary school, and when they pick up on a concern, see it as their responsibility to kind of spot that, and then look at what it means to work with the whole family and not the individual that they're focused on. So I think we've learned that whole family approach can have a huge impact. We need to take that whole family approach out to a whole load of other professionals and other people who have contact with